Oh, thank you very much, Michael. So gut health starts in the mouth, and a lot of people don't realize that. There are many functional medicine doctors and patients that work on the gut for years and years and years and years. And what's hampering the ability for these patients to be well is the fact that there is toxicity and inflammation in the mouth, which I've been looking at for 40 years, and understanding that there is a very big connection. And that's why I wrote this book, The Mouth Body Connection. And I wrote this, ironically, for the layperson, and I get more emails and thank yous from dentists who never knew a lot of what was in here because they weren't taught that in dental school, like cavitations and what's wrong with root canals and all that stuff. So today we're going to really take an interesting look at the mouth body connection and its role in total body wellness and longevity. So I'm going to actually go bring the presentation up now. I'm expecting, is the screen, can you guys see this?
Oh, no, Dr. Curatola, can you open the Zoom window again?
Yes. Yeah,
Yep,
let's do that again. Thank you.
Mhm.
Okay, here we go. I have to make
Yep.
this big. All right.
Yep,
And we're
do
going
you
to
see yeah.
share the screen. Got it. And I'm going to be sharing my desktop. Okay. And here we go. Let's see if this works. Okay.
Looks
Can
great.
everyone see that?
Yep.
Okay. Thank you. All right. Once again, here we go, everybody. I promise it'll be a treat. A lot of people don't realize that your ability to live a longer, healthier life is tied to this mouth body connection. So, total body wellness and longevity is going to be the topic today. And we're going to be looking at root causes of what compromises that and a lot of things that you probably never knew before. One of the, um, so I always loved this quote from Rene Dubos from 1965 that the state of your health or disease are the expressions of the success or failure by you to respond adaptively to environmental challenges. Now, all of us and many who are on this program, Truth About Health, are going to be talking about a lot of those environmental challenges, both outside your body and within your body. So, the ability for you to respond adaptively plays a key role in your ability to live a longer, healthier life. And as I like to say, oral health is the 800-pound gorilla in the wellness room. And even ancient Ayurveda said you cannot have a clean, healthy body without a clean, meaning healthy mouth. Not that you brushed and flossed. It means that the really, if your mouth is unhealthy, you will not have a healthy body. Um, the real problem with the mouth not being understood in the medical community and really by patients as well, thinking that dentistry was more of a mechanical thing. You know, you get a filling, you get it filled, and you get a cavity rather, you get it filled, and you go get a brush twice a day and get your teeth checked twice a year, and then you're groovy. But the reality is that 90% of toxicity and inflammation in the human body starts in your mouth. And, about 150 years ago, they unplugged dentistry from the rest of the body. And they said, oh, if you want to study this little cube in the mouth, then you go to dental school and physicians study everything else around that receptacle. Notice the feet are cut off because then you go to podiatry school. So this illogical divide has hampered our ability to treat the whole patient. The father or the forefather of the mouth body connection goes back to a really amazing person, Dr. Weston A. Price, a dentist from the early 1900s. And this dentist actually in 1917 was presenting on the status of our knowledge of the relationship of mouth infection to systemic disease. He was talking about the mouth-body connection. And what's interesting, this was to the St. Louis Dental Society, and what's interesting is that they scoffed at him. They laughed at him. They didn't think that was true or that was possible. And now we know, indeed, it's exactly that. So I wrote this book, The Mouth-Body Connection, to really help everyone understand the bidirectional effect of the mouth as a mirror of what's happening in your body and a gateway of chronic inflammation, of toxicity throughout your body that dysregulates the body's microbiome and dysregulates your immune system. And this is linked to everything from cardiovascular disease, type 2 diabetes, obesity, premature birth, Alzheimer's disease, and more than 6 types of cancer. 6 types, ranging from oral cancer to breast cancer to lung cancer, pancreatic cancer, colorectal cancer, and others. So the reality is esophageal cancer. I knew I was forgetting one. But we would say, how is this possible? How does what's going on in your mouth cause colorectal cancer? And we're going to speak about that. So the mouth is a mirror to the body. We even know in the ancient science of Ayurveda, which I'm a fan of, our tongues are a very powerful and primary diagnostic tool because when digestion is working well, it influences every aspect of our health. And when you may not think about it, the tongue is the beginning of the digestive tract. As I said, gut health begins in the mouth. And we look at lots of different things. There are different tongue characteristics that correspond to Vata, characteristics, which Vata tongues are typically dry, narrow, smaller, rough. And then you have Pitta dosha types. So the three dosha types of Vata, Pitta, and Kapha. Pitta dosha type tongues are typically reddish, medium size, somewhat dry, and have a pointed tip. And then Kapha dosha types, these are the large, thick, wet, light pink in color. So you'll see these different characteristics in the tongue as a mirror to what's going on in your body. And the most famous is something known as the meridian tooth chart, that every tooth corresponds to a meridian to various organs, tissues, and glands in the body. And these meridians are also known as energy highways. And blockages in one of these meridians, say on an upper molar here, on the upper left, that's on the right side, tooth number 14, that would correspond to the left breast, thyroid, stomach, and pancreas. So you really have a lot of interesting analogies. The upper left is spleen. The upper right molars are, here you can see the breast, the thyroid, the stomach, and the pancreas. So the spleen on the left, the pancreas on the right. We see people have root canals or infections in these teeth, and we see all of a sudden they're getting cystic breast, they're having thyroid malfunction, gastric issues, and it's especially notable like with root canals that are failing, where you have infections, heavy metals, all kinds of things. People who have their wisdom teeth removed, very often we see problems in the gut and the heart. And these are meridians that regulate, that help and are connected to the regulation of these vital organ groups. So it's not that an infection in the tooth directly causes an infection in the breast, although that's possible because there are bacteria in the mouth that have made them their way all the way down to the colon. But what we see is that there's a very important regulatory process. We regulate, and in biologic medicine, which biologic dentistry is a subset of, we regulate on 5 different levels: microbially, biochemically, energetically, that's meridian flow, Psycho-emotionally, you can actually dysregulate your body by just what you think and what you set your intentions on. There's a Dr. Bruce Lipton wrote a book, the Biology of Belief. What you believe can actually alter cell expression, alter cellular expression, alter even alter DNA. Just psycho-emotion. So that's a very important level of regulation. I have many patients who've had Lyme disease that come to me to clean up their mouths so they can start regulating, their body can regulate and really recover from Lyme. And many of them have been sick for a while and they get what I call stinking thinking. They don't think they're going to get better because they've been sick for 3, 4, 5 years. They've gone to 50 doctors. And if you don't think you're going to get better, you're not going to get better. And those are patients that I often hesitate to treat. So I want a patient to come in and say, doctor, I'm on a path to wellness, and there's been twists and turns, but I believe that I have a divine capacity to self-regulate and heal, and that's what I'm asking for your assistance with. That's a much different statement than, I don't know if I'll ever get better. That's a totally different mindset. So it's really important to understand that your mouth has an important role in regulation on all of those 5 levels. Those 5 levels, again, microbial level, your microbiome. We see biochemical regulation. People with heavy metals often dysregulate their thyroid, which affects hormone expression and things like that. And there's also we talked about meridian flow and psycho-emotional, and then we also talk about being regulated in terms of the spirit body. We are mind, body, spirit. That's not just an expression. So regulating on a spiritual level is staying connected. Prayer, meditation, yoga, these are ways that you can stay connected, get out of your mind, and really get to your higher self and get out of your day-to-day consciousness, which gets affected by so many different things. So let's talk about the mouth as a gateway. And that gateway is very interesting. In the center of this slide, you'll see the oral microbiome, what we call the oral microbiota. And what is that connected to? 5 types of cancer, autoimmune and other immunodeficiency disorders, dysregulating your immune system. Your oral microbiome being out of balance causes an inflammation-induced cancer, carcinogenesis, or the propagation of cancer. There's been correlative studies on this that are absolutely indisputable, that an imbalance in the oral microbiome can be connected with inflammation-induced carcinogenesis. Dysregulating your immune system and your oral microbiome being out of balance puts you at risk of serious viruses and bacterial infections. Dysregulating the natural God-given ability you have to regulate. So dysregulating the immune system, impaired immune function down here, leading to hematological malignancies, and a hyperactive immune response or inflammatory response. So lots of inflammatory diseases. The number one inflammatory disease very connected to the oral microbiome and your mouth is rheumatoid arthritis, Sjogren's disease, and other issues. So we really need to look at this idea of the connection of your mouth, of your mouth being a gateway to a lot of systemic disease. Let's just talk about gum disease. That's the body's number one source of chronic low-grade inflammation. And so gum disease puts you at risk of all of these different diseases: osteoporosis, stroke, Alzheimer's and dementia, cancer, respiratory disease, heart disease, diabetes, rheumatoid arthritis, which I just mentioned. But let's talk about the difference between men and women. Men, gum disease gives you gum disease is more prevalent in men than women, but women are more prevalent later in life. What does it affect? How about impotence? Chronic low-grade inflammation from gum disease makes you 3 times more likely to be impotent. 14% more likely to develop some of these cancers. We talked about kidney cancer and blood cancers. By the way, those are two more to the other five that I mentioned. 50%, almost 50% increase in kidney cancer. 54%, actually, a study from Harvard University was men with advanced gum disease, 67% higher incidence of pancreatic cancer. Then you have blood cancers. And there's a direct link between gum disease and the onset of type 2 diabetes in women, puberty and menstruation. And you also get an increased gingivitis due to hormonal imbalances. If you have gum disease, you're more likely to have a preterm baby, which are born with many complications, such as cerebral palsy, preterm babies. Menopause, 86% more likely. There's the big jump from men and women. Women in menopause, 86% more likely to develop gum disease. So I hope this is an eye opener, but there are thousands and thousands of studies backing this up. So oral health is indeed a key to your longevity. And you have all of these diseases. You know, we used to think gum disease was about tooth loss and bad breath, and decay was, you know, just about pain and other things. But look at lung conditions, strokes, heart disease, mouth cancer, and diabetes. Oral cancer is the third most prevalent cancer, and we'll talk about that a little later on. So improve your oral health, you're going to live longer. You're going to improve your telomeres, your mitochondria, and you're going to live longer. But chronic inflammation, this is a study from 2019, chronic inflammation as a link between periodontitis and cancer. So there's inflammatory mediators produced during gum disease development, which mediates the progression of cancer, and it also can exert an effect directly in transforming cells from normal to anaplastic, or what we call cancer cells or malignant cells. So gum disease, this is from 2015, gum disease bacteria deemed a catalyst for cancer cell growth. So this is very, very real and a major concern. These were some of the cancers I mentioned. Oh, here's gallbladder and melanoma skin cancer. So there's a host of many types of cancer related to gum disease. So how does this happen? How do we go from healthy gums to advanced gum disease? And the answer here is it all starts with the terrain. We used to think that when I was in dental school I started in 1979, 1983, we were taught that there are bacteria that, you know, cause the gum disease. So you got to kill everything. So that's why you had products like Listerine and Colgate Total. That was old science, a germ theory, where, you know, the bacteria flies in and, you know, sets up shop and you get this disease, kill it, right? Kind of like I like to say the raid theory of the microbial world. Like, oh, you know, bacteria like cockroaches, spray raid, kill them all. And we really know now that this is about dysbiosis, the progression from health to disease. So what is dysbiosis? It's an imbalance of the bacterial microbial flora. And gum disease was the cover of Time magazine back, easily 18 years ago. And we talked about gum disease and the inflammation and its link to heart attack, cancer, Alzheimer's, and other diseases. We started talking about this back in 2006, 2004, when we were looking at the human microbiome, which you'll probably hear other speakers talk about the human microbiome and its role in basically keeping you alive. And this was a book called Plague Time by Paul Ewald, which was one of the books I read when I did the Harvard Medical School program in complementary medicine. I read this book, which was very interesting because gum disease, by the way, everybody, it doesn't hurt. You don't usually have pain. Your breath starts to smell, your gums bleed, but it doesn't really hurt. So it's really on the level of a stealth infection. And where you want to be is in a state of balance, what we call homeostasis. That's what we want. And we don't want to eradicate the microbiome. That's over here. So you use charcoal, you do oil pulling every day, and you're going to strip the microbiome. You use xylitol, products with xylitol kill strep mutans bacteria, and they say, oh, that prevents cavities. No, you're killing the microbiome. What you really want to do is you want to promote balance. You don't want to just nuke the scorched earth policy we've had in oral care products. Is terrible. So when you're in balance, you're fine. When the microbiome is very, very thin or stripped, we call that an atrophic biofilm. And that's where you get tooth erosion and tooth sensitivity, and your gums are sensitive. You get lots of canker sores. That's really due to an atrophic biofilm. That's kind of stripping everything using chemical detergent toothpaste, even natural toothpaste with essential oils like clove and peppermint and tea tree oil. Tea tree is a little plant in Australia, but when you put it in toothpaste, it kills everything. And it can even kill your pets. Xylitol can kill your dog. So xylitol is a chemical, a lot of misinformation about xylitol. So, and we'll talk about that a little later. But here you can see that when the microbiome is out of balance in this direction, you get inflammation of the gum and you get this thick, sticky, smelly film on your teeth. So here is a strip microbiome where there's kind of like a desert. This is a scary jungle of lions, tigers, and bears. By the way, some of those lions, tigers, and bears are spirochetes, anaerobic bacteria. So these green and yellow are aerobic, healthy, vibrant, healthy garden. This is full of weeds and garbage, and it hasn't been tended to. We'll talk about that in a little bit too. But it's very important for everyone listening to understand the ancient relationship between man and microbe. And it goes back. Microbes covered, the earth was covered with microbial slime before we were even on the earth. And so I'm sorry, yep, go right ahead. I'm sorry for that interruption. I'm actually giving this presentation from the American Airlines Lounge at JFK Airport. So, at any rate, the relationship between man and microbe goes back to before we were on the planet. What's interesting is that a bacterium is the same shape of a mitochondrion, and they even divide in a similar way. As a matter of fact, there's a verse in all ancient scripture going back to the book of Genesis, chapter 2, verse 7, that said, God took from the dust of the earth. Well, the earth wasn't covered with dust. The earth was covered with microbial slime. And so God really took from the slime of the earth, microbial slime, breathed his spirit in it, and we became mind, body, spirit. If you're a creationist, that's what you believe. If you're an evolutionist, then mitochondria may have evolved from a bacterium. I believe that it was a cosmic event, the creation of man, the first man and the first woman, and we can see many similarities here. So I have these 4 microbiome commandments. I'm not comparing myself to Moses going to the top of the mountain, but the first commandment is everyone should know we're made of microbes. There are 10 times the number of microbes, estimates even higher, some lower, but 10 times the number of microbes than our own human cells. And that these microbes control us. We do not control them. If you go to war with your microbes, you will lose. We've been trying to kill bacteria with antibiotics and microbes with antibiotics for years, and we have lost that war. We now have antibiotic-resistant bacteria, many shapes and forms, some living in and on your bodies, some living in your mouth, and and in the environment around us. Everybody's heard of MRSA. It can close a school gymnasium. Well, there's all kinds of MRSA types of antibiotic-resistant bacteria that are in the mouth. I routinely see them when I perform cavitation surgeries and when I extract infected teeth. Often I'll biopsy and I will take a pathology sample of the area and find antibiotic-resistant bacteria. Because if you go to war with your microbes, your microbial flora is very intelligent. They exchange genetic information when they're threatened and under attack. They exchange genetic information. They even vote. It's called quorum sensing, and they flip a pathogenic switch, and that's where good bugs go bad in the mouth. By the way, bacteria are bacteria. They behave good. We call them probiotics when the terrain is balanced. And they behave bad. We call those pathogens when the terrain is out of balance. So to stay healthy, make peace with your microbes. Now, this is another interesting discussion. How do bacteria in the mouth get to the rest of the body? How are pathogenic bacteria in the mouth found in atherosclerotic plaques around the heart? How are they found? The number one bacterium in colorectal tumors is Fusobacterium nucleatum, one of the most common bacteria in the mouth. How do they get there? Well, they can go in the bloodstream. If your gums are bleeding, they can go in your bloodstream. But what's interesting, and years ago, we believed that, it's not possible for bacteria to get past the hydrochloric acid in the stomach. Well, we have discovered since the advance of the Human Microbiome Project that bacteria do get past the hydrochloric acid in the stomach. There are bacteria called persisters bacteria, and they kind of secrete a shell around their organism, and you have the ability for them. They have taken bacterial plaque off the tusk of a mastodon, frozen in a glacier, put it on a petri dish at body temperature, and you see microbes flourishing and coming to life. So they can withstand some very adverse conditions. So you want to keep, if your mouth is a mess, if your gums are bleeding, if you have this kind of inflammation you see in the upper left corner in this interproximal area, which is where gum disease often starts, you really want to make sure that that's healthy. If you're pregnant, if you have heart problems, if you have, all kinds of other systemic issues. So we know that the digestive tract is now a transportation system for unhealthy bacteria in the mouth, and so is the bloodstream directly from the soft tissue in the mouth and the periodontal tissue in the mouth. And the interaction between the oral microbiome and the gut is pretty intense. So you have the bacteria from the mouth colonizing in the intestines, persisting there, leading to activation of the intestinal immune system, another really debilitating inflammatory condition, which is related to ulcerative colitis and Crohn's disease. If you have any of those, please see a biologic dentist. Really look at what's going on in the mouth, and I'm going to give you the best ways that you at home can take steps to deal with imbalances in the oral microbiome so that you don't develop these kinds of problems. But the progression of oral bacteria in the gut include Porphyromonas gingivalis, very common pathogen for gum disease. Fusobacterium nucleatum, oh boy, that is a bad pathogen when it goes from good to bad. So it's kind of like you have bacteria behaving in a nice environment, and then you have the next environment, which I'll show you, is where a good neighborhood goes to a ghetto, and these bacteria express themselves pathogenically. And Klebsiella pneumonia is the one that's most connected to ulcerative colitis and Crohn's. So the microbiome and your immune system is constantly shaping each other. And it has a mutual um, ambition, aim to thrive. And it actually is a key modulator in what we call dysimmune conditions, unbalanced, acquired immune deficiencies like allergy, asthma, autoimmunity. A lot of autoimmune diseases are the result, we're finding now, of an imbalance in the microbiome. We just never knew before. So the stratification of the microbiome and the compartmentalization of your immune system, they work hand in hand. And this is really key. I mean, I had a theory that a lot of people who had gum disease and toxicity in their mouth, they had a harder time recovering from COVID or even recovering at all because their immune system was compromised. So what did we learn? We learned that the immune system in the mouth has to harmonize with the ecology of the commensal bacteria, fungi, and viruses, not just bacteria. It's this complex community of microorganisms. And it is a key role is to help you defend against pathogenic microbes. So your immune system, on one hand, it gets dysregulated by pathogenic microbes, but on the other hand, when it's competent, it defends you against the progression of pathogenic microbes. And here we were talking about Fusobacterium nucleatum, and it's a community bug turned pathogen, and it's been connected to all of these adverse pregnancy outcomes, including preterm birth and another one, preeclampsia, lots of studies, GI disorders, like colorectal cancer, inflammatory bowel disease, appendicitis, cardiovascular disease, rheumatoid arthritis, respiratory tract infections, Alzheimer's disease. I mean, Fusobacterium nucleatum can really wreak havoc when it is a common benign bacteria in the mouth, and it turns a pathogenic switch when it's out of balance. And how does it get out of balance? We're going to talk about that. So there's a number of ways that we acquire and maintain a normal oral microbiome, and these are the factors. I want everyone to take a look at this, and the factors affecting dysbiosis or imbalance of the oral microbiome and corresponding dysregulation of the immune system. Number one, diet and nutrition. Definitely a major factor is diet and nutrition, toxicity and endotoxin production. From what? Root canals, cavitations, titanium implants. They all produce endotoxins. Sleep apnea, airway health. This is real. This affects 1 billion people on the planet. We're going to talk about this. Harmful oral care products. Pet peeve of mine. I spent 20 years of my professional career developing oral care products that help to balance the oral microbiome. And we'll talk about that as well. Lack of exercise. You wouldn't think about it, but lack of exercise actually can affect dysbiosis of the microbiome. You have a sluggish circulatory system, a more compromised immune system. So you really want to produce those short chain fatty acids with exercise, which are anti-inflammatory. Stress. We talked about psycho-emotional issues. We talked about mental, emotional, physical. Stress is very debilitating and dysregulating to your microbiome. Amazing, right? We are mind, body, spirit. They are not independent of each other, everyone. So I encourage everyone, take an inventory of these. Let's talk about diet and nutrition for a minute. Saturated fatty acids and vitamin C. Now, you see some vegan options and you see some non-vegan, like Arctic char and non-farm, and healthy salmon. I'm trying to think of the word. Free deep ocean. But really, you want the B vitamins and the vitamin E. By the way, I am a strong supporter of a plant-based diet, but I do not have any opinion about people who need and require and perform better with a keto paleo diet that is not plant-based. I mean, lots of studies though support plant-based as a long-term healthy, really immune boosting, longevity promoting diet, and very, very interesting. Um, um, Diet and the oral microbiota go hand in hand. Toxicity and endotoxin production. This is a biggie. So, jaw cavitations, you may have heard that term thrown around, stealth infections, usually where your wisdom tooth was removed. It's an unhealed hole in the jawbone caused by an extracted tooth or a root canal or an injury to a tooth. It's a silent infection, chronic illness, and chronic inflammation. And I created a very specific protocol to this. And if you want in these, I think we're giving this as a free gift. What are jaw cavitations? Why they're significant, and what are the objectives of jaw cavitation surgery? We're going to give you that. And I also have a screening guide for the top 10 sources of chronic inflammation and toxicity. This is a jaw cavitation. So here was a schematic drawing of an extracted, here's the radiogram, here's a schematic drawing of an extracted tooth. Here is when the gum tissue is flat back and it was accessed. It's literally a hole in the jaw. Here's a root canal that was done that most dentists would say, oh, this is a terrible root canal. If the root canal is done well, look, this root canal is done well. And then when you flap it back, you see this cavitation. That's horrific. So often we can't see this type of defect unless you use 3D cone beam because it's superimposed with the tooth. I'm sorry for the gross picture. So the way to see these sources of toxicity, endotoxin production and all, is 3D cone beam is really the gold standard, because an infection like this seen on the side is not really seen on the front as well. So 3D, this is 3D, everyone. 3D computerized, cone beam computerized tomography. Big source of discussion right now is people who have chronic Lyme, and are their root canals keeping their Lyme alive? And there's a lot of studies that are underway that are starting to show yes. Now, am I telling everybody to run and get their root canals ripped out of their head? No, but if you have Lyme disease, get a 3D cone beam, see if there are any cavitations around the root canals. By the way, root canal procedures by itself are in my opinion, really don't work long term. It's simply put, I think the future of endodontics is in stem cells and pulpal regeneration without devitalizing a tooth, basically embalming a tooth and doing taxidermy on a tooth to do a root canal. Because anything dead in the human body decomposes. We call it necrosis. So let's take a look at sleep, airway health. I'm going to go for about another 10 minutes or 15 minutes, and then we'll do some questions. So sleep and airway health is a big issue. A lot of risk with that. The dangers of sleep apnea. You have 75% of these cases are undiagnosed. 1 in 5 have obstructive sleep apnea. A lot of it has to do with the shape of your mouth and tongue tie, narrow arch. Your tongue sits further in the back of your throat, limiting your ability to breathe. It's linked to all of these risks: heart attack, hypertension, reflux, diabetes, stroke, congestive heart failure, motor vehicle accidents, and impotence. 80% of people, 80% of people are, as I said, 75 to 80% unaware. And it also affects children. Very often, children are misdiagnosed with attention deficit disorder, ADHD, and excessive bedwetting is a finding in children with sleep apnea. So common treatment has been to force air down your throat with this device called CPAP, but we actually do airway correction, expand the airway to make more room for your tongue to come forward and relieve the tongue tie. And this is something called the DNA appliance, which we do. I recommend everyone get an airway study at least once in their life. So this is correction with the DNA appliance before, and you can see, look how much wider. This person on the left here on the bottom is breathing through a coffee straw. So you can see this rapid change in the airway and the position of the tongue. Here's the arch before. This is a narrow arch, almost squeezing the tongue further back in the throat after a wider, more Roman arch. So here you have a Gothic arch on the left, a Roman arch on the right. Let's talk about harmful oral care products. So does everyone know why there's a poison warning on toothpaste that was mandated in 1998 by the FDA? It was because a spike in fluoride fatalities in children due to the introduction of a toothpaste that tasted like bubble gum. It was fluorescent blue and had sparkles in it. It was called Crest Sparkle. And took 10 years, but there's enough fluoride, sodium fluoride, in a regular size of toothpaste to be fatal to 2 children under 5. Now, this is the poison warning that came out in 1998. Warning, keep out of reach of children under 6 years of age. And why are they brushing with it? Well, if more than used for brushing is accidentally swallowed, get medical help or contact a poison control center right away. I don't know about all of you, but I don't think toothpaste should have a poison warning. I think toothpaste should be edible, and that's why I spent 20 years developing a toothpaste that you can eat, because it's insane to think that any child or any person would be putting toothpaste in their mouth that could have a poison warning. So I created a toothpaste that you can eat. It's all vitamins, minerals, and it's got vitamin C, D3, vitamin E, K2, coenzyme Q10, MSM, which stimulates stem cell activity in parallel. You can do a nutritional product without making it poison or using something to kill everything, whether it's natural with oils or chemicals. And so fluoride, we've been overdosed. We know that. The government knows we've been overdosed. And basically, fluoride is a toxic halide chemical that is not a nutrient. There's over 62 studies linking drinking fluoridated water and lower IQ in children. There's over 20 studies on the decrease in bone density and strength and osteoporosis and osteopenia. So you want to live long, get this chemical out of your body. You do not need it. It was the enamel of your teeth was never designed by God to need fluoride. Fluoride was looked at because it rapidly displaces a mineral called hydroxyapatite and converts it to fluorapatite, because fluoride was a made-up word, F minus, is the most highly negatively charged, non-radioactive element in the periodic table. So it converts your teeth and bone from hydroxyapatite to fluorapatite. It's very, very, very hard. But if I drop this glass, as you know, on a floor, it'll break in a million pieces. It also makes it more brittle. It makes your teeth and bones more brittle. There is a lot of toxic effects of fluoride. And I don't want to go off any more about that. I want to move along. But again, everybody understands what we're really talking about is going from the pesticide approach in oral care to organic gardening. Not kill everything, kill germs, kill strep mutans or any of that, but promote a healthy, balanced garden. And that's why I created this. It's the first prebiotic, not probiotic, prebiotic, meaning it nourishes your indigenous healthy microbiome. Probiotics in the mouth don't work because your oral microbiome is as unique as your thumbprint. So it keeps very harmful bacteria, it keeps harmful bacteria we call pathogens, and good bacteria. Um, um, it keeps you in a stable, balanced state. We just did a randomized double-blind clinical trial showing that indeed we restore low film thickness and a very low diversity, so you don't have that thick, scary jungle, but you have a healthy aerobic microbiome. And we do that with these essential antioxidants and cell energy enhancers: CoQ10, vitamin C, D3, vitamin E, K2, and MSM, which I spoke about, stimulating stem cells and periodontal ligaments, as well as a unique blend of microminerals to help your teeth remineralize naturally. First study back 10 years ago, we reduced inflammation in 1 week more than Colgate Total claimed in their 6-month studies, or 12-week study, 3-month study. They were there. But then we went further and we looked on the effects of soft tissue health, and we had a 42% reduction in gingival inflammation, 46% reduction in plaque, 72% reduction in bleeding. Everyone, folks, this is about respecting the science. I'm a scientist, and I am a doctor, and I am also a clinician, and I believe that too many products are brought onto market without science, but with all kinds of marketing claims. So the reason this works dramatically is it respects the science. This was a photo in just 4 days of changing what that person was brushing their teeth with. Let's talk about lack of exercise. Exercise alters the microbiome. I mentioned this before. There were increases in certain microbes that can help produce substances called short-chain fatty acids. These reduce inflammation. And finally, stress. If we look at the effects of stress on the oral microbiome, we see that a lot of it is the signaling with the vagus nerve, gut hormone signaling, tryptophan metabolism, and the production of microbial metabolites. And again, here's that short-chain fatty acids, which help to reduce inflammation. So the 5 steps you can take to biohack, that's a popular word, your body through your mouth. Get a cone beam, everybody. We do virtual consults in New York and in our offices in the East End of Long Island. I will read your scan and let you know if you have any of these top 10 sources of toxicity and inflammation. You want to remove your infected root canals, non-biologic fillings such as BPA composites and mercury fillings, silver amalgam. They're not silver fillings, they're 52% mercury. The dentist should call them mercury fillings. They're only 26% silver. So it's a fraudulent misrepresentation to call those silver-colored fillings silver. They're 52% mercury, the most toxic, neurotoxic element on earth. Get your airway fixed. Check to see if you're going to do a sleep study and cone beam first, clean up your mouth, get your airway fixed, support your immune system before, during, and after dental treatments. Avoid harsh, natural or chemical-containing toothpaste and mouthwash. I always put natural in there, because just because it says natural does not mean it's good for you. Like tea tree oil and arsenic, they're natural. They occur naturally. Even fluoride occurs naturally. Doesn't mean it's good for you. And I want to thank you. You can follow me here, and I'm happy to come back on for 20 minutes or so and answer some questions as quickly as I can.
Oh, thank you so much, Dr. Curatola. That was some great information. So I understand that you are at the airport to catch a plane, which would be a good place to be, to catch a plane. So okay, so real quickly, so you're practicing on Long Island?
Manhattan. I'm in Manhattan at 865th Avenue, and I'm on Long Island, in the Circle in the village of East Hampton.
The village of East Hampton. And for those that want to get in contact with you, how would they get in contact with you?
You can reach me. I should have put that slide back up at Dr. Jerry Curatola, DrGeryCuratola. And the office website is www.rejuve-health.com. And there is a number if you hit. I think there's a special number for new patients, but if you go to 212-355-4777, that's the best way, and you'll be guided to an onboarding person for new patients. But I do a lot of virtual consults, so somebody can get a cone beam locally. Excuse me. Somebody can get a cone beam locally. I can read it, and they can be on the other side of the planet. I've done consults from people in Africa to people in Asia to right in New York. If they didn't want to come in first, we could do a virtual consult, or you can come in and visit us. We have an amazing team, and maybe we should go to some questions.
Sure. And actually, real quickly, does doing a cone beam, is that something that's covered by insurance, or is
it can be? It depends on the person's insurance, but it's a couple $100. It's an amazing diagnostic tool. It almost makes dental x-rays, the old little two-dimensional dental x-rays, obsolete. The problem with this is a lot of dentists don't know how to read this cone beam, and there's so much information. But you can send it by Dropbox, and we can read it, and we can give you an opinion and some advice and diagnostic information that we see on the cone beam.
Thank you. So we have a brief time period. I see that we got a few hands raised, so I'll try to get to those questions as well. Regarding the toothpaste, because obviously everyone who's listening is clearly interested in taking care of themselves. They're willing to go the extra mile, and they're doing what they think is right. A lot of people are using toothpaste without fluoride, like Tom's of Maine, but that has xylitol in it.
Right.
I realize you've got a great product that I'm personally interested in checking out. Are there other toothpaste on the market that you'd recommend that they might be able to find in their supermarket?
One of the oldest toothpaste that was around before I was doing my microbiome research with Vitin was a product called there was a product called Auromere, Auromere. But I want to point out, I'm glad you brought that up. There's a lot of toothpaste out there pushing nanohydroxyapatite. That was developed by NASA in the 1970s. It's a synthetic mineral. Okay, it's not natural. It's synthetic. It's a microparticle. It actually penetrates the cell membrane and can damage DNA. And there's toothpaste out there going, wow, we're nanohydroxyapatite, so we could drive that mineral into your enamel. Our body, major principle of biologic medicine, is our body has a natural ability to self-regulate and heal. You do not need to shove minerals in there, because when the oral microbiome is in balance, there's something called a dental cyalomicrobial complex. Teeth, saliva, and microbes. They work together. The microbes transport minerals from saliva. Can you picture this? The microbes transport minerals from saliva to remineralize your teeth naturally. Your saliva has ionic minerals like calcium and phosphorus. I put ionic minerals in the toothpaste. No nanohydroxyapatite, nano charcoal, nano anything.
And are there other things that people are doing and going out of their way, trying to be healthy, like taking that product that you were just mentioning, that is actually having a counter effect or making our oral health?
Absolutely. So the greatest amount of misinformation, I thought I was going to cover it, but time just kept going. I was getting as much information out as I can as I'm watching the clock. But the interesting thing is that there's a lot of misinformation about a product with this substance called xylitol, and a lot of people don't know the truth. Xylitol was developed by a subsidiary of DuPont called Danisca in Europe, and the original xylitol, and it was a brilliant invention, let me say that, because they took a bio-waste, GMO corn cobs. Everybody hear me? Xylan from GMO corn cobs. And they're out there saying, oh, well, I don't use GMO corn. I use pretty little birch bark. Well, it goes through an industrialized process of hydrogenation. They used rainy nickel as a catalyst, a heavy metal, to make this white powder that was a sugar alternative, another methadone for the heroin industry of the sugar industry. You know, we had aspartame, saccharin. Now we have xylitol, erythritol. Erythritol is even worse. Xylitol is not absorbed or metabolized by the human body. The body sees it as foreign. So it's very disturbing to the oral microbiome. Those were the studies from Finland on keeping strep mutans from sticking to teeth. And so they extrapolated that to say, oh, it prevents cavities. No, it strips the microbiome, disturbs the microbiome. And then you have the other issue is that it's not absorbed or metabolized in the gut. So it goes through your gut, and it's been linked to gastric bloating, wicked diarrhea, and all this. So they stopped using it in foods, but it's in a lot of toothpaste. And dentists still swear by it. It's actually a preservative in mouthwash. It's one of the reasons why I haven't come out with a Revite mouthwash, is because it's parabens and other things that cause this to be a problem. So everyone understand that about xylitol and other things like tea tree oil. Look for that, peppermint oil, and all this. There's all these essential oil combinations. Thieves toothpaste. It's kill. It's time to get out of the chemical business. Time to get out of the scorched earth policy. Make peace with your microbes and do organic gardening in your mouth, please.
So we had a dentist on our panel last night, Dr.
Jorgensen, yes.
Yeah. And she had mentioned oxalates. So obviously they are part of green vegetables, and everyone's talking about how great vegetables are. You know, this is the real truth about health. Do a lot of plant-based eating here, and green vegetables are an essential part of that, or a vital part of that. So she said that oxalates could be bad for you. What are your thoughts on oxalates, and are they, is it something to be concerned about specifically with your teeth and bones?
I always crack up. I forget I forget the doctor's name. He's all over the internet, and he talks about lectins in food. It's Dr. Gundry. He's all about lectins, no lectins. And are we still on?
It looks like something. Yep. It looks like you're sharing your screen, or someone.
Oh, okay. No, I wasn't sharing, actually. There we go. Okay, thank you. And oxalates are another one of those. Oxalates can be harmful. They can be inflammatory. And so you can minimize them in many ways, right? You can, you can reduce both lectins and oxalates in ways. But I want to make a point here of saying that some oxalates are not really going to be that harmful. If you have tons of oxalates, I think what Dr. Jorgen was saying is somebody who's like green, raw green, that oxalates can accumulate and have a harmful effect. I haven't done that much research on oxalates, so I don't want to speak that much about it, but I'm always very, very interested in seeing, I am more in tune with the mindset that moderation has always been a key theme in health and longevity. People who are not extreme at anything, even extreme exercise can be harmful. And then there's healthy exercise or moderate exercise, which is very, very helpful. Even long walks, 10,000 steps or whatever. So, that's all I have to say about the oxalates, but I know Dr. Jorgensen made a big point about that.
So just so I'm mindful of your time, what time do you need to leave so that way I can?
I've got 10 minutes.
All right. So I'm going to ask you just a couple quick questions. I'll put them together, and then I'll let the audience take the remainder of the time. So what do you do if you had your wisdom teeth out And how do you prevent getting the impacted wisdom teeth in the first place? Why do we have that? And then, and I'm gonna throw a few at you. And then causes of receding gums. And I know they do bonding to cover up the recession sometimes. Is that a good solution to resolving that? Or is there a way to naturally have your gums unrecede, I guess?
Yes, and those are great questions. So quickly,
Yes.
let's talk about the wisdom teeth.
Yes.
Wisdom teeth, in my opinion, everyone needs a 3D cone beam. So the idea, and what really the approach now, especially with children, is expanding the growth and development of the human jaw when you're young. So guided eruption. There are products like MyoBrace and other things that help with creating the growth and development that's necessary to accommodate the teeth. Way too many wisdom teeth don't need to come out if they were guided and there was the proper oversight and direction at an early age. But too often, dentists wait for the wisdom teeth to come in, and they're coming in like this, sideways, or like this, or like this, or like this. And those malpositioned wisdom teeth can be a problem. So number two, if you have an impaction that could be damaging the other tooth from a wisdom tooth, you want to make sure that if it is surgically removed, you need to have it done biologically, where there is a grafting and a proper treatment of the remaining bone so that that area regenerates and heals, and you do not get a cavitation. And number three is the fact that a 3D cone beam, even in the mid-teen or early teen years, can be helpful in identifying the proper growth pattern of even a panoramic film is helpful, but 3D gives us much more information. So that's about the wisdom teeth. The second part of your question was about gum recession, I think,
Yes.
right?
Yes. And then bonding
three causes of gum recession. Okay. First cause, believe it or not, actually I can put four causes. First cause is gum disease. People smile, they look in the mirror and they're like, oh my God, my gums are up here. What happened? My gums receded. No, the gums didn't recede. You had undiagnosed and untreated gum disease that caused the bone to resorb, and the gums follow the bone resorption. So you're losing bone around your teeth. And if you have gum recession from periodontal disease, that's serious. The second reason why there's gum recession is you have people that, if your teeth do not hit properly, like in other words, the teeth should hit like this and they hit like this, and you have something called a bad bite or malocclusion, that can cause the formation of what's called abfractions. That's abfraction. Abfraction or abfractions are caused by bad occlusion. So get your bite, do an Invisalign, get your bite better aligned. You will stop the recession. Third, am I up to number three? I think I'm up to number three. Parasites. Parasites can affect at the gum line. So sometimes we look at that and dysbiosis. I see that more in people who are immunocompromised and people who may have jaw cavitations. They can also have parasitic activity. Interesting, kind of freaking out. Really wasn't taught that in dental school. And then the fourth reason why you get gum recession is people have a hard toothbrush. These are the people who want to scrub the hell out of their gums. They're brushing improperly and they're going like this. But most of the time, the dentist doesn't even look at the other three reasons. They're like, oh, you're brushing too hard. That's why you got the gum recession up here. Using a hard toothbrush, you're brushing incorrectly. Believe it or not, that's probably the fourth reason. But in terms of bonding these areas, there's a couple of different ways you can deal with recession. It really deals with the amount. There's something called a pinhole technique that some people are a candidate for. It's developed by a periodontist, where you can actually lift the drape of the gum over the recession so the teeth will appear better and you can get readhesion of the soft tissue. Need to be healthy. You could look at that as an option. A lot of people are not options for that. So bonding composite resin, if it's BPA free, that's one way. Some people do porcelain veneers. Some people do nothing, but sometimes when you realign the teeth, you actually get reattachment of periodontal tissue. So I've actually seen that, where when the tooth is like this, the gum's up here, and when you move the tooth into proper position, you can get a return of proper periodontal tissue at the cervical margin, the gum margin of the tooth.
So that would be the only way, is it to realign your teeth? It doesn't. There's no way to have it
realign the teeth. You want to check and see if you have parasites too. So you really want to stop that. I mean, gum recession is an annoyance. It can be an aesthetic issue and all that. The important thing is that if the recession is significant and the teeth are sensitive, one of the things that I use in my practice is ozone. Ozone sclerosis or seals the dental tubules, so teeth become less sensitive. Every dentist should use dental ozone. It's a wonderful, wonderful treatment.
Okay, so we just have a couple minutes. I'm going to throw it out to
Sure.
the audience here. So Dave Ross, state where you're from and ask your question. Dave? Okay, moving on to the next person. Ruth L, state where you're from and ask your question.
There
you go.
Hi.
State where you're from and ask your
Hi,
question.
Ruth.
I'm from Toronto, Canada. And I had a tooth fall out, my front tooth. And fortunately, I kept the tooth and the dentist was able to glue it back in, but I do need to have an implant. And I was listening last night to you, but I didn't get what you suggested for whether you were against the metal, the titanium.
Yes.
What would be a good
Excellent question. Excellent question. No one should put metal in their mouth. Titanium implants, and I had 3, were found to be inflammatory. They do endotoxin. So what you should have, zirconium. Zirconium is really the gold standard now for non-metallic implants. Most of them have come out of Switzerland, but zirconia implants actually are not inflammatory to the human body. So the bone that grows around a zirconia implant is vascular bone. It has a blood supply. Bone around titanium implants is like scar tissue bone. It's called sclerotic bone. That's the difference. So thank you for asking that question. And find a dentist that is competent in doing zirconia implants.
Thank you.
You're welcome.
Thank you. Do you have time for one more question?
Sure.
All right. So we're going to go to Marta V. State where you're from and ask your question. Marta. Oh, we're not having a lot of luck here. Marta.
We lost him.
Let's see here. All right. Now we're going to go to Shelly. We're playing here. Go ahead.
Hi, Shelly.
Hi, can you hear me?
Yes.
Hi, apologies. I've just actually logged in. I'm in the UK, so I've just only got chance this evening. So apologies if I'm asking a question you've already addressed. But I wanted to say there's a trend for hydroxylapatite toothpastes at the moment. I don't feel that that's the correct thing to do. Would you agree? And if so, why?
Yes. And you know what? I did speak a little about that. I talked about nanohydroxyapatite actually being harmful to the soft tissue in the mouth. And also the fact that, putting minerals in, microhydroxyapatite is fine. I actually use ionic minerals alone. So hydroxyapatite is the mineral that your teeth and bones are made of. The problem is a lot of it is synthetic. It's made in a lab. And nanohydroxyapatite was actually developed by NASA in the 1970s. So microparticle, okay, nanoparticle, not okay. So look on the tube. If it says nanohydroxyapatite, it's a big craze right now. It's another fad. The reality is what I was explaining is that when the oral microbiome is in balance, you don't need any of this garbage. You can actually... as long as the microbiome is healthy and robust, it transports minerals, ionic minerals from saliva, ionic calcium and phosphorus, which makes hydroxyapatite and helps to remineralize your teeth naturally. But that's what happens when the oral microbiome, this microflora of the mouth, is in balance. When it's out of balance, you actually get demineralization. So you get the opposite effect. So we've looked at this. I've done a lot of research. It's called the dental cyalomicrobial complex. And a lot of good oral microbiome research came out of the UK, by the way, in Birmingham.
Okay.
And Leeds. So,
Okay.
yeah. So anyway.
Great.
Yeah, go ahead.
Thank you. Thank you very much for that. So, do you have time for one more really quick question?
Let's do one more. Sure, one more. I
All
feel
right.
bad.
I'm going to throw it back to Dave
I'm in
Frost.
the airport lounge.
All right, Dave,
hi.
I'm giving you another chance.
Yeah,
Just
hi. Thank you
ask
so much.
questions.
I'm Dave from Massachusetts. I have just quick questions. What you
Sure.
thought about ionic toothbrush, water floss, and chewing sugar-free gum, sorbitol gum after meals? Thank you.
First two I love. Ionic toothbrush, great. Water flossing, I recommend them. I have them in my office. Water flossers do a really good thing. They help to eliminate food, plaque, and debris that's especially interproximally with teeth. A lot of people have trouble flossing. Water flossing can be really helpful. Another thing that water flossing does, the other thing that I like, is the hydromassage and the microcirculation of the gums. The third thing, sorbitol is another sugar alcohol, along with xylitol and erythritol. All of the sugar alcohols, sorbitol is probably less damaging than xylitol, which is not absorbed or metabolized. Erythritol is the worst of the bunch. Erythritol is absorbed, but not metabolized, so it stays in blood plasma. It's been linked to thrombocytic clots. There was a big study that came out last summer about heart attacks and strokes from high plasma levels of erythritol. Blood plasma levels. All righty.
That was a very good speed round of those questions. So thank you so much. We'll make sure that we end it now so you can catch your plane.
Thank you.
We can unmute the audience real quickly so they can share their appreciation for the doctor.
Thank you, Doc. Thank you so much.
So much.
95 miles a gallon.
Thank you.
Yeah, so